Prior to performing liposuction, what we do is we actually inject a fluid in the areas that we're going to perform liposuction, and that fluid contains two things. One is lidocaine, which helps with pain during surgery. The other is epinephrine, and epinephrine helps clamp down on the blood vessels, so there's very minimal blood loss prior to liposuction. After we have that fluid in, what we do is we start to perform liposuction, and what that usually entails is there's a cannula and it's attached to a suction system. So then once it's entered in specific areas that we're trying to remove fat, it suctions out the fat cells. And it's not just kind of randomly sucking out fat in areas, but it's really important to go to a plastic surgeon because there's different layers of the fat under the skin, and you really want to target those specific layers to get the best body contouring result that you can get. One of the most common questions that I'll get from patients regarding liposuction surgery is how much fat can be removed. And this goes back to one of the core principles that I think every plastic surgeon practices, and that's safety. The maximum amount of volume we're allowed to take off is 5 liters. So I never remove more than 5 liters. Now, with that said, every patient is unique. Some patients, you only need a couple 100 milliliters. Some patients may require 2 to 3 liters of fat removal. It really depends on what areas we're treating, how many areas we're treating, what is the patient's goal prior to surgery. So that's why it's very important to undergo a consultation prior to surgery with your plastic surgeon so that you can have realistic expectations. Liposuction is one of the most common surgeries that I perform. Liposuction is very safe as long as you go to the right surgeon. So after liposuction surgery, the first couple days after surgery, patients will be quite sore, but it'll be controlled with medications that we give patients prior to surgery. After the first 2 weeks of surgery, patients will feel much improved. At this point, they're wearing their compression garment, they're undergoing their post-operative massages. At about 2 weeks, I would have already told them they can go back to work as long as they're doing light duty. They exercise, I tell them they could start light aerobics. It'll probably be a little too early for them to start lifting any heavy weight at that point. And then at about the 6-week mark, patients usually are doing great at this point. They're continuing with their compression garment, their post-operative massages, they're back at work. At this point, they're fully back at the gym without restrictions. But really what I tell patients is, at about the 6-month mark is where a lot of the swelling will be down, and you could start seeing the final result of what we created with the liposuction. But it takes about 6 months to a year to really see the final result of the body contouring procedure.